Hi, I'm Jill Feldman, a lung cancer patient and advocate.
And hi, I'm Christine Lovely. I'm a lung cancer physician and scientist.
So Christine, thank you for joining us with Hope with Answers today. There is so much information out there about non-small cell lung cancer, but there's also small cell lung cancer. Could you describe the difference between the two different cancers?
Absolutely, and that's a really good question. So there's two types of lung cancer that we think about. One of them is non-small cell lung cancer. That is the more common type, about 85% of all lung cancers. And we call it non-small cell lung cancer because literally under the microscope, the cells look bigger. Small cell lung cancer is about 15% of all lung cancers, and we call it small cell because under the microscope, the cells look smaller. And so two different types. The types are defined by what the cells look like, the tumor cells look like under the microscope, and two very different types of lung cancer, actually.
So when you say 15%, it's still a large number of lung cancer patients, isn't it?
Yes, absolutely. So 15% of 235,000 cases a year in the United States. So imagine this for a minute. Every year in the United States, there's 235,000 new cases of lung cancer. 15% of 235,000 is tens of thousands of patients in the United States alone that have small cell lung cancer every year. So it seems like a small percentage,
Right.
but it's a small percentage of a very big number.
Right, okay. And you say it looks different underneath the microscope. So then is it treated differently?
Yes, so small cell lung cancer and non-small cell lung cancer, even though we call them both lung cancers, they are treated differently. And so it's very important for patients to make sure that they are clarifying with their doctor what type of lung cancer they have, because the way we think about treating them and the way we think about diagnosing them is different. When we think about the treatments for small cell lung cancer, it's usually chemotherapy and sometimes radiation therapy.
Okay, and so when a patient has a biopsy to be diagnosed with lung cancer, what's important for them to ask their doctor?
Yes, so for all the patients out there watching this, when you are talking to your doctor about what kind of lung cancer you have, you really want to ask, is it non-small cell lung cancer or is it small cell lung cancer? And even within non-small cell lung cancer, there are different patterns, but the first kind of triage, the first break point is it non-small cell or small cell? Because the tests that you're going to get after you break off whether it's small cell or non-small cell are very different.
Okay, great. Well, thank you so much
Thank
for
you so
joining
much.
us with Hope with Answers.
It's a pleasure to be here.